Hello, my name is Dr. David Chapman from McGuanago Animal Hospital, and I am here today to talk about vaccinations.
All right, Dr. Chapman, what vaccinations does my dog need?
Your dog needs, of course, the core vaccines, which would be distemper virus vaccine. That is a combination of distemper, adenovirus, parainfluenza, and parvovirus, as well as, of course, the rabies vaccine.
All right, are vaccines for dogs really safe?
Yes, they tend to be safe. These pharmaceutical companies do a lot of testing, so these dogs' vaccines are pretty safe for us to use. We tend not to have any reactions at all.
Are there any risks or side effects ever associated with dog vaccinations?
Of course, there always is. Whenever you vaccinate an animal and you get the immune system all revved up, we'll say, there's a potential for any reactions. They tend to be something as simple as a swelling of the face, sometimes vomiting, diarrhea. Of course, you always have just pain in the vaccine location as well.
At what age should my puppy receive its first vaccinations?
I always think that staying with the standard, about 8 weeks of age is probably the best. Anywhere between 6 to 8 weeks of age is best. We start with that with the distemper virus vaccine. That of course includes the parvovirus vaccine as well. And then your dog may at that time need the kennel cough vaccine as well at that age, but then we prefer that you come back in 3 to 4 weeks for us to booster the distemper vaccine, and then 3 to 4 weeks after that, when they're about 16 weeks of age, for that final vaccination.
What is the difference between core and non-core vaccines?
Your core vaccines are I would say your most important vaccines. So that would be your distemper vaccine as well as rabies. Non-core vaccines are your, let's say, extras, and those would depend on your dog's lifestyle. So be it a kennel cough vaccine, leptospirosis vaccine, or Lyme vaccine.
Why is the rabies vaccine important for my dog?
Most municipalities and governments require that you have a rabies vaccine. In the state of Wisconsin, rabies is required of all dogs 5 months of age and older. And then depending on where you live, they may want you to do it every 2 years or 3. Where we live here, rabies vaccine is then required after that first booster every 3 years.
Can my dog be vaccinated if they are sick or on medication?
On the medication end, yes. Most of the time, most medications allow us to vaccinate your dog. There are a few out there that would prefer that we make sure your dog is weaned off of a certain medication before we vaccinate them. But most of the time, it's very safe. On the illness end, depending on the illness or what's going on, we may choose to postpone the vaccination until your dog is well.
How can I keep track of my dog's vaccination schedule?
Here at McGuanago Animal Hospital, we have, of course, a nice record-keeping system. So we will alert you via text message or email when your dog is due for the next vaccine.
And lastly, what should I do if I miss my dog's vaccination appointment?
Give us a call if you do miss a vaccination appointment. A lot of these vaccines give us a certain duration of immunity. So it could be, just 12 months, it could be up to 13 months. It really depends on the vaccine and what we're vaccinating for. If your dog is out, let's say 18 months on maybe a Lyme vaccine, and your dog is a big hunting dog, or you're out on the trails a lot with the dog, we may want to booster that vaccine in 3 to 4 weeks after that first one to keep your dog as safe as possible when they're out there doing their job. If you have any questions about dog vaccinations, please give us a call at the office here. Our number is 262-363-4557, and we're always here to help you out.
You want to